Hi there, my name is Mike Sullivan. I'm the Program Director of Valor Medical Services. I'd like to welcome you to this presentation from our series of continuing education for pre-hospital providers. Now, before we begin, there's a few things we need to go over. First off, the information presented in this program is intended for use by trained EMS providers. Also, due to variations in protocols and scope of practice among different states, departments, and agencies, this program may discuss or depict procedures, medications that are not acceptable in your daily use. If you see something in this presentation that varies from your agency's policy, always follow your department's protocols. Also, none of our authors or presenters of this program have any conflicts of interest or financial relationships they need to disclose. We do have documentation of this on file available in our office upon request. While we do our best to make sure that all the content we present is the most current available, participants are reminded that medicine is indeed a dynamic science and thus changes rapidly. So things may have changed since we've written or compiled this program. Please always follow the most up-to-date information available. In closing, if you have any questions about this or any of our other programs, please email us at info@valormed.net. Thank you very much and welcome to the program. Alrighty, now that we've got all that legal stuff out of the way, before we get started, let's talk about coffee for a second. If you're looking for a great cup of coffee, you probably want to check out coffeebrandcoffee.com. They're an online retailer, American owned and operated. They have a wide variety of coffees, teas, hot cocos, all sorts of different flavors. They've got all sorts of organic teas. You can get coffee in bean form, ground form, K-cups, whatever your heart desires. I've had several of the different blends and several of the different flavors. Absolutely fantastic. And because they are an American-owned small business, they don't have a big warehouse, so they don't have a big supermarket sales business. They roast it, they bag it, they ship it to you. It'll pretty much be some of the freshest stuff you'll ever get. Definitely highly recommend them. And they've got a promo code out for us now. If you use promo code VALOR SDS, you get a 5% discount off any order. So you can save a little money, try some fresh coffee, see what you like. They've always got different flavors coming through on their website. Some are permanent, some are limited time only. And if you look right there in the picture, you can see they've even got, yes, double caffeinated. Definitely a winner around this office. Alrighty, now let's get to class.
Good afternoon. This is Janie Jones. I am a critical care paramedic and I am also an instructor here at Valor Medical Services. So today what we're going to be doing is we're going to be talking about at-risk populations. This is kind of a sore subject or something that is a little harder to talk about for most people. So we're going to cover it as objectively as possible, but also with the information that you will need as providers in order to provide the best care for these at-risk populations. So first we're going to look at our core objectives. We're first going to look and determine what training resources are out there for special populations. Now, special populations is a fairly broad term, and it can cover anything from human trafficking victims, which is becoming a horrific problem across the globe, domestic violence. And domestic violence is not just, a spouse or two people in a relationship having fights, things like that. It's a much more broad dynamic than what we initially kind of categorize. We're going to recognize the unique characteristics of at-risk populations, determine the appropriate actions of EMS professionals in the presence of at-risk patients. And then we're also going to recognize circumstances that may indicate abuse, whether it be domestic abuse, human trafficking, non-accidental trauma. And again, this can cover across all age, socioeconomic statuses. So we're going to go and kind of delve into this and talk about these objectives. First of all, we need to define what is an at-risk population. Well, first of all, the first things we talk about or think of would be a household partner, whether it be a parent-child, spouses and significant others, even siblings. A key point to note is that this can occur regardless of the ages or gender involved, and it's more dependent on an unequal balance of power within that relationship. The example here on the screen is just that B is dependent on A, and then A can abuse B because there's nothing that B can do about it. And this is a very common scenario. You see this a lot, whether it be that parent-child, that child realizes that they are dependent on the parent. That parent is who's theoretically providing them with shelter, food, things like that. And so that child knows, I need my parent. But then that parent is empowered thinking that they can abuse that child because there's nothing that kid can do about it. This is a very common thing that we see within spouses and significant others. Again, we can go into the psychological portions of this where, the most predominant that you'll see is a narcissistic personality disorder, where that person, that narcissistic individual, basically empowers themselves through constant abuses, maybe verbally. It can accelerate to physical abuse, things like that. But they have that dependent person so mentally controlled that they believe that they cannot exist without that abuser. And therefore, that becomes a huge issue. So pediatric patients, many times just because they are a child, they are dependent on others for their needs. They may be developmentally delayed, whether it be having physical delays, cognitive mental delays, many different issues that can fall under that category. That pediatric may be nonverbal or have very limited communication ability. That again makes it very difficult for them to be able to express they need something. And then that power control of they know that they're dependent on others or adults. And if they're not just tolerating and taking this, who else is going to take care of them? To the other side of the spectrum would be our geriatric population. Geriatrics, they may be very fragile or overly dependent. They may have lost independence due to a medical issue, things like that. Polypharmacy is a huge component within this because anybody that's taken care of a lot of our geriatrics knows that they are, their medication list is 2 to 3 pages long. So that polypharmacy effect can have cognitive impairment, physical impairment due to the medications that they're on. They may have some cognitive impairment. As they age, they may lose their cognitive abilities to process information, to be able to remember things. Again, we're looking at situations such as dementia, Alzheimer's, anything that can cause that cognitive impairment, and they become dependent on somebody else because they are not able to process and use that same information. And then again, they also have financial dependency. Either they have monetary funds that is being controlled by a family member a lot of times that, they don't know what they're doing, so let me take care of this. Or they've exhausted their finances throughout life, throughout maybe a medical issue, to where they are dependent financially on somebody else to provide for them. So, trafficking victims. They have complete lack of independence and lack of resources. They are completely dependent on whoever their traffickers are. Geriatrics, again, they may be fragile or overly dependent, may have lost some independence. And then pediatrics, same information as the prior slide. They may be developmentally delayed in some way. Maybe they were a micropreemie. Maybe they had issues at birth. Maybe throughout their development in their early years, they have gotten some delays that they do not process on what is an age-appropriate level. They could be nonverbal. That limited communication ability very much hinders their ability to communicate their needs to others, or maybe dependent on other adults. So how can we address this? Throughout our initial education with EMS, very often these are not issues that we talk a lot about. They're not issues in that initial education period where we discuss and look at things like training to recognize and help support victims of human trafficking, or to help train, identify, and support domestic violence victims. So I've given you a couple of resources here on the screen that do have some resources for training, recognition, things like that, to help you better identify potential victims and to offer them resources to seek help, shelter, things like that. So also we want to look at mandatory reporting laws. Most states have some version of mandatory reporting laws, and it is incumbent on us as providers or on our agencies to be knowledgeable about the specific laws in their state and have appropriate policy in place. What I know as the mandatory reporting laws in my state may vary somewhere else, but I know, and I have taken training and classes to understand what my obligation is as a mandated reporter, as an EMS provider, to report domestic violence or human trafficking or abuses of any kind, whether it be in children, vulnerable adults, or in geriatrics. So please, once you have completed this training, I strongly encourage you to reach out, whether it be to your agency, or you can reach out to law enforcement and find out, where can I get training to understand the reporting laws within my state? So how can we really address this? How can we understand what we're looking at? Well, first of all, recognizing the signs of abuse. Studies show that domestic violence wounds are most likely to occur in the following areas. Most likely to the face and neck. They're easy to get to, and they're the first thing that, in those bouts of rage, that somebody is able to make contact with physically. Their arms, grabbing them by the arm, maybe you're trying to walk away, but getting control over that person by establishing dominance. Their head. Any kind of injury to the head, dependent on if it's just a hand, if it's an object being thrown at and makes connection with that head, possibly can dissociate that person. Then they're unreliable because, oh, well, they don't even remember this situation. So how can they be reliable and be telling you the truth? The back and buttocks. While these are a little lower on the list, they're actually very common areas that you can see signs of abuse, because the abuser very often thinks that these are hidden areas. They're not going to be shown. They're not going to be seen. The breasts and then the abdomen. Abdominal trauma may be seen more profoundly during pregnancy. And that is because many times the abuser is either not happy about the fact that the pregnancy has occurred, or realizes that the woman carrying this child has already established a bond with that child and is willing to do whatever to protect it. So very often you will see with abdominal trauma during pregnancy that it is an attempt to cause an abortion, cause damage to the growing child. So that is one that we do see more often than I want to say. Finally, the genitalia, because so many times abuse is a precursor to further abusive behaviors. Many times that genitalia, they are less likely to abuse and cause wounds to, because there's a secondary sexual abuse characteristic involved. So that's one of the lower ones that we see, but it is indeed possible to see that. Also, you need to know that when you look at this person, they are going to possibly have injuries that are in various stages of healing. You may see a fresh purple bruise on an arm, and then look at their back and see multiple bruises that are purple, green, yellow. They're in various stages of healing. Also, let's look at recognizing some indications of human trafficking. Human trafficking has become absolutely a just disaster just within this country, of seeing how prolific it is. With human trafficking, a lot of times you're looking at pediatric patients or patients that are potentially in their late teens, early 20s. And that's just because many times we can be a little more covert with how we disguise them and things like that. If you see these victims, again, you're going to see those bruises that are in various stages of healing. You're going to potentially see scars or mutilations or infections due to lack of medical care. Things that, you look at and you're like, well, why didn't you take care of this? Because it would not be like this. They have very restrictive behaviors surrounding them. They may not be able to get to a medical center or a place of treatment. And so therefore, we are going to see things that we as providers attempt to see as like, oh, well, you're just not taking care of yourself. No, it's due to their inability to seek medical care at the time that these incidents take place. Urinary difficulties, pelvic pain, pregnancy, and rectal trauma. Number one cause of human trafficking, or number one use of human trafficking victims, is for the sex industry. So therefore, when you see issues with, pelvic pain, urinary difficulties, usually secondary to infection, pregnancy and rectal trauma due to forced sexual abuse, these are things that are very common within our human trafficking victims. Chronic back, hearing, cardiovascular, respiratory problems, poor eyesight, eye problems. A lot of that eye issue is due to they're either being held in basements, things like that have very poor lighting, poor working conditions, problems with that, malnourishment and dental problems. Again, they have no access to medical care. Many times when you see these patients, they are going to be exhibiting signs of psychological trauma, that disorientation, confusion, phobias, panic attacks, heightened startle reflexes, things like that. They are victims of abuse. The disorientation and confusion could be secondary to the circumstances with which they are being held. They don't know what day it is. They can't tell you where they are, because many times these people are drugged and moved in, with blindfolds, things like that. They may have odd phobias because they know, oh my gosh, now what's going to happen? Or, oh, I hear this sound. And they tie it to that process of abuse. Panic attacks and heightened startle reflexes. Both of those we can see, yes, we do have patients that are not human trafficking victims that may exhibit these responses. However, when you see a patient that can be startled by the sound of a voice, that exhibit these panic attacks to what we see as nothing, and we can't figure out why, many times it's because of the conditions that they have been in and the psychological abuse that they have underwent that causes these to be exhibited. So challenges as EMS providers that we're going to face with these patients. Number one is going to be assessment challenges. They are going to be poor historians, especially the younger that they are when they are abducted and placed into the trafficking. They don't know their medical history. They don't know what medications they're on. They don't know if they're on any other therapies for anything, because they have little to no access to medical, dental, or other care. So we're going to have those challenges of they legitimately cannot answer you. The other thing that you're going to see as far as especially your trafficking victims is the reliance on caregivers. And in abuse situations, you see this, getting or dispensing medications. Withholding medications or over-medicating is very commonly seen in pediatric and in elder abuse. Access to medical care and follow-up. Well, we'll take you when we feel like it, or you're not sick, you're fine. So because our victims are so reliant on the caregivers that they have, it's hard for them to either have access to their medications, access to medical care, or if they need a follow-up for an injury or a trauma, well, we don't want to follow up at that same location because now they know us and may have suspicion. The other issue would be interpretation of verbal and non-verbal communication cues. Most of the time, what we say, those verbal communication, that's what drives the healthcare decisions, because we're able to speak up and say, I have these issues. This is the response to whatever medication I've been on. Well, if these people are nonverbal or scared to verbalize this information, that's going to drive us to making those assumptions where, oh, they're just faking it, or, oh, they don't really know why they're here. They know, but dependent on the area that they're around and how close they are to their abusers, many times, especially with abuse and trafficking, you're going to see the abuser is going to be right there in your face. They're going to be right there telling you everything, and that victim is unable to communicate what the legitimate problem is. So treatment priorities for EMS. Obviously, we're going to provide the care needed for whatever the chief complaint or complaints are that you're presented with. Okay, I have abdominal pain, I have chest pain. We're going to provide that care for that chief complaint. If possible, especially if you your spidey senses have kicked in, you're noticing some of these cues and things, you want to encourage that patient to be transported. Whether or not you transport, and we highly want you to do it, document your findings and observations extensively extensively. I mean, what time you got there? What did the abode or home look like? What did you notice? Did you notice, it was clean, or, oh, there's like 10 people running around and there's beds and mattresses on the floors? Notice all of your observations of the surroundings, what the patient looks like, how they communicate. Are they dressed? Are they, if it's an elderly patient or even with a child, are they in a diaper that is soaked through? Everything you see, hear, experience in that situation, you need to document it thoroughly and extensively. And then once you complete that patient interaction, you must complete your mandatory recording and reporting based on your agency and state policies and laws. Do not wait until you finish your shift. You need to complete all that reporting while it is fresh. Make sure everything is thoroughly documented in your reports and report accordingly while it is still fresh in your mind, while you know this is what I saw, smelled, this is what happened, so that the reporting can be initiated, the investigation, if needed, can be initiated immediately. So, some closing thoughts. Regardless of the specific situation, we need to be aware of the potential for various populations to be abused or victimized. This is not something that only happens to children or only happens to elderly adults or only happens within certain relationships. This is an issue across all age ranges, all demographics, and all socioeconomic populations. In many cases, as EMS providers, we have an additional insight into this dynamic because we're able to observe the interactions on scene. We're able to see whether it be a home that they're coming from or anything like that. We are able to observe and see. This house had no food. There was bugs crawling everywhere. All these little things that can add up and substantiate this allegation of abuse. By recognizing the potential for an abuse situation, we can help bring attention to the situation and potentially help end it. Now, are we going to be successful every single time? Absolutely not. But by recognizing the potential and the possibility of this being a situation of abuse, you, through your documentation, by your care of this patient, can absolutely have an effect on the outcome of that situation. And in many of these cases, over prolonged times, can end in extensive and permanent damage up to death. And we have the ability through our training and through recognizing these situations to potentially help end it.
Hey there, I'd like to thank you all for stopping by, checking out our video. If you want more information about our company or any of the stuff we do, you can check out our website. If you need EMS continuing education hours, we do have our online education platform posted up there. Also, we have our email address if you have any questions. You can find us on YouTube, Facebook, Twitter, and Rumble. We maintain channels on all of those. Also, please like, share this out to your friends, subscribe, help support the channel, and we'll keep putting more videos out there for you. Oh well, enough about that. I know what I'm up for. Time for a cup of coffee. Y'all have a great day. Be safe out there. Bye.